My guest today is Adam Zivo, investigative journalist, columnist for the National Post, and director at the Center for Responsible Drug Policy. We discuss Safe Supply, a program where governments provide addicts with clean drugs at the expense of taxpayers. Adam explains the roots of the program, the hell it's unleashed on the cities that have adopted it, and the profit motives involved. Adam is a top-tier journalist with a keen eye for political distortion. This conversation illuminates an issue many of us see but know little about. Stay tuned. Adam, thanks for talking to me today, man. I've been a reader of yours for a while, and I've been meaning to reach out, and I'm so glad we made this happen.
Thanks for inviting me onto the show. I'm always happy to have long conversations with interesting people.
Yeah, well, you caught my eye because you've been doing quite a bit of coverage on the safe supply issue, and I'm from Vancouver originally, and actually the I don't know how to explain it to people who aren't from there, but like the apocalyptic reality that has come out of safe supply is part of the reason why I packed up my family and left. We were actually looking, we were in between places and we were looking for a new place, and we went to a playground at the school nearby. I'm a dad, so we had to check out the school, and somebody was shooting heroin right in the basketball court. And my wife and I were like, yeah, no, I don't know if there's anywhere we can go here anymore. So I want to start by asking you what drove you to the story, and what have you come to realize through covering the safe supply story?
Well, when it comes to what drove me to the story, there's two facets here. So the first facet is that I grew up in a medical family. My mom was a pharmacist for 30 years. And as a kid, I remember hearing stories about some of the sketchier parts of the healthcare industry. And keep in mind that all of her friends were doctors and pharmacists too, so they collected all of her stories together. My mom had a small family business, a small family pharmacy that she ran for about a decade. And I remember being like, 12, 13, 14. And she was having conversations with my dad because some investor had come in and wanted to partner with her to open up another pharmacy. And they liked the idea, but they weren't sure where the money came from. And they thought it might be mafia affiliated. And ultimately they said no. As I got older, I realized that my mom had suffered for, standing up for her principles in other ways. So, for example, at one pharmacy that she worked at, there was a scam that the owner was running where people would come in with fake pain, and then they would go and say, well, give me some opioids. The pharmacy would dispense fake, no drugs. They would dispense nothing, but they would charge OHIP and say that they had given those drugs to the patients. And then they split the proceeds, right? So they were just fraudulently billing OHIP. And my mom said, no, I don't want to do that. And they fired her. And then in a third story, in the early 2010s, Ontario instituted a narcotic prescription monitoring system. So it used to be that prescriptions weren't monitored. So you could take the same prescription to different doctors and get it filled multiple times before they realized what was happening. Then they created a centralized system that checks who's filled what, where. And of course, in the weeks before that system was implemented, prescriptions for narcotics skyrocketed because everyone wanted to get their supply in before they lost access. And my mom recently told me a story about how at that pharmacy, one patient came in with a prescription for 3,680 milligram OxyContins.
Holy.
So to give you a sense of that, like that is 3 years worth of the highest level pain medication, like literally the highest level pain medication you can get, like in a tablet form like this, for every single day. And she said, I'm not filling this. And then she called her boss, and her boss said, well, you should fill it. It's money. And she said, no, you come in and you fill this because my license is on the line. Right. So there's that. And this is how I've had some connection to healthcare. For me, it is not totally new. Now, how I came into Safer Supply specifically is that I like to write a lot about crime and addiction. And I've liked to write about that for a while because when I lived in the gay village in Toronto, I lived beside an encampment. right? And I lived beside a park that was really well known for being a cesspool of crime. And I got really tired of hearing people shrieking at each other from my balcony and assaulting each other. It didn't feel comfortable when you would wake up at 6 a.m. every day for like 2 weeks at a time with just violent arguments. People saying, I'm going to break your fucking hands. I heard the word faggot more in that neighborhood than I did in anywhere else in Toronto, which as a gay man, I thought was like, well, why is this? Why should I
It's
tolerate
strange. Right,
Yeah.
right.
And I had my ex was assaulted. People were assaulted in my neighborhood, and I thought to myself, okay, well, I've got to speak up about this, and I did. And then people said, oh, well, you're stigmatizing the homeless, you're attacking the poor, you're callous. And I was like, no, I would just like to feel safe in my neighborhood. And of course, the people who said this stuff, they usually lived in really nice neighborhoods far away, so they never had to deal with this bullshit.
Yeah,
And it was very easy for them to show limitless compassion when the crime that they were enabling was impacting other people.
right.
So that got me into that. And then I started writing more about that and became known for that. And at the very end of 2022, I was contacted by an addiction physician, Dr. Julian Summers, who's now become quite infamous. And he said that he was silenced by the BC government for a variety of reasons, including his criticism of safer supply. So I wrote a piece about that. And then I realized that there was more there. Someone said, you got to look into this diversion thing. Now, for your listeners who don't know, Safer Supply is this program that distributes free pharmaceutical alternatives to potentially tainted illicit substances. So, for example, Jason, let's say you are addicted to fentanyl, and that fentanyl could be cut with xylazine or benzodiazepines that could kill you. You don't know. You don't know if the dose you're getting is actually what you think it is. That might accidentally cause you to overdose and die. And so the rationale here is that if you get your drugs from the government, at least you know what's in it and you know that it's not contaminated, and that can keep you alive until you're ready to seek treatment. And you know what? This sounds lovely in theory. In theory, it is a lovely idea, and I can understand why people support it. But in practice, these drugs get sold. And that's how I learned about this diversion thing of people selling their drugs, their safer supply on the street to buy stronger street substances. Now, I realize I've been monologuing. I can continue, but should I stop? Do you want to interject? What do you think?
No, I mean, what made me interested in the story to begin with, aside from being from Vancouver, was there was an original iteration of this podcast that I did very early in the pandemic, and I talked to an old friend of mine who is part of. Oh man, why am I blanking on the name right now? The injection sites in the Lower East Side of Vancouver. And we talked on the podcast about safe supply. And at the time I was actually a supporter of the idea, just because of just the huge amount of overdose deaths that were occurring in the lower mainland of British Columbia. Right. I mean, there was just like, he was saying that at any given time, he would have 20 overdose deaths happening all at the same time. And he would literally have to just pick who lived and who died in terms of getting them Narcan. Right. But the more we talked, the more he actually changed my mind on the entire program because of the diversion issue. And we have most of our listeners are in the United States. So for our American listeners, what we're talking about here, Adam described the safe supply part of it, but there's what diversion is people who are receiving safe supply drugs, turning around and then selling them and taking the money and buying the dirty drugs that they want. And what he was telling me was that there were a lot of people who were making like fentanyl in single room occupancy, I guess SROs, and then selling dirty fentanyl on the streets. And the addicts actually preferred the dirty fentanyl to like the safe, the cheap, safe heroin. And so that to me just sounded like it was completely counterintuitive. And now, what we have in Vancouver and people in California and San Francisco are starting to see the same thing because they have a safe supply program down there now too, is that it's not stemming the issue, it's exacerbating the problem. It's creating new problems. So I guess what I want to start with is what are the roots of the safe supply program in British Columbia and Canada in general? How did this enter into just the political framework?
Well, so Safer Supply was first piloted in 2016 by this doctor named Dr. Andreas Sereda. Uh, the project initially was focused on giving free drugs to sex workers with the idea that if you give them these drugs, then they don't have to buy it, which means that they have less reason to sell their bodies, which
Mhm.
keeps them safer and then reduces the transmission of diseases in the neighborhood. But very quickly, that program grew to service drug users of all types and give them, free hydromorphone. Hydromorphone is a pharmaceutical opioid as potent as heroin. It's the drug that you were referring to earlier when you talked about that cheap heroin. And over time, they produced a whole bunch of research saying that this was great, that this program was fantastic. But when you look at the underlying research, a lot of it was bullshit. So essentially, what they would do is that they would just interview drug users who were accessing Safer Supply, who were in these programs, and say, what do you think about this? So they'd interview maybe like 20, 30 drug users at a time. And then they take these, interviews and they collect the data. And then they'd say, well, the drug users say that this is great. And they promise us that they're not selling these drugs and that it's helping them. So I guess that's true, you know. And there's no problem with that methodology. We can absolutely trust it. It is objective.
Right.
And this is ridiculous. This is absolutely ridiculous. But somehow this flies. And then, and then on top of that, what they'll do is that they'll do like surveys. So they'll send out a whole bunch of surveys to drug users, and then they'll say, how often have you overdosed in the past week? Yada yada yada. How's your life been? And of course, maybe some of them are answering honestly, but many of them understand what they're supposed to say, and they give false answers to bolster the perceived benefits of Safer Supply because addicts are not stupid. A lot of people who claim to be hyper progressive about addiction patronize addicts and think
Yeah.
that they're idiots. No, they are human beings who, yes, their minds are hijacked by addiction, but they still retain all of their critical faculties for the most part. So they know how to
Right.
manipulate people. They know how to lie. Every person who I've spoken to who's in recovery was like, yeah, I lied and manipulated people. And that's what they do. But for some reason, there's a blind spot there. So this program was, considered highly successful. Safer Supply is working. It is innovative treatment. We're keeping people alive. It saves lives. And then 2020 happens. So the pandemic happens, and there's this concern that people are going to experience withdrawal and they're going to suffer because you can't, buy drugs on the street anymore. So this one organization, the BC Center on Substance Use, the BCCSU, produces these clinical guidelines that, essentially form the foundation of Safer Supply.
Right.
And that is used for the dual crisis of COVID and the pandemic and the opioid crisis. And then, it's a COVID measure that is then, hijacked to change society completely in Canada. So Safer Supply is scaled up all across the country, particularly in BC. And right away, we start seeing problems, right? In communities where Safer Supply is active, the street price of hydromorphone plummets. So it used to be $20 a pill. It goes down to $1 a pill if you're buying it directly from a Safer Supply client, maybe even 50 cents. And then people will go buy it and then resell it in bulk at $3 a pill or $5 a pill. And then someone might resell it at a community farther away from a Safer Supply dispensary at $10 a pill. So I mean, at the least, you're getting 50% off, but you can get up to, 95% off depending on how you buy. And then these opioids, because like the reason why people sell the hydromorphone is that it's too weak, right? Fentanyl is 50 times stronger than heroin. Hydromorphone is basically heroin. So, of course, you're going to sell your hydromorphone to get the fentanyl that you want because the hydromorphone doesn't hit. And what does that mean? It means the hydromorphone goes to people who are less experienced opioid users because the
Right.
people who are on fentanyl don't want it. You can't sell it to them. They're selling it. So who are the people who are getting this government heroin? Well, it's disproportionately kids, right? On their end, they don't know what hydromorphone is. I talked to over 50 kids over like in 2023 who had issues with Safer Supply, like, who said that hydromorphone flooded into their schools. Not all of them knew it was coming from Safer Supply. Many of them did. Younger
Mhm.
ones didn't know. The older ones did. And they say, yeah, we thought it was just a pain reliever. People told us it was pain medication. It's safe. It's from a pharmacy. The government is giving it away, and we don't know what it is. And when you tell them this is basically heroin, it blows their mind because kids know they're not supposed to take heroin because stigma works. When you
Right.
stigmatize heroin, that keeps people from using it, but there is no stigma around hydromorphone. Plus, it's a pill, so you have to inject heroin for the most part, and no like kids are not going to do that for the most part because it's scary. But you give a kid a pill and you tell them it's pain medication that makes you feel good at a party. That's a very different situation, and they don't realize it's addictive, and then they get addicted, and then some of them graduate onto fentanyl, which then kills them.
That is fucking baffling how that is happening. I mean,
Mhm.
the way what you just laid out right there explains so much. And I'm sorry, man. I'm speechless. Like, I might actually have to cut this part out because I don't know what to say. Like it, because essentially what they're doing is they are creating the next generation of addicts through their safe supply program. Now, that's not you saying it. That's me saying it because that's
Yeah.
very obviously what's happening. Right now, what are the profit motives here? Because this is the thing, and this is the part that I've been wondering. Those drugs are coming from somewhere, right? So if the government is providing them, then they're purchasing them from somebody or they are developing them themselves in their own labs. But one way or the other, somebody's making money. So who's making money out of this safe supply environment?
Well, okay, so it's complicated, and there's a whole bunch of different facets here. Uh, at the top level, we know that Purdue Pharma is making money here. So Purdue Pharma, for listeners who don't know, they're the predatory company that caused there to be an opioid crisis in North America to begin with. So opioids were used very sparingly up until the 1990s, right? You basically use them for cancer patients who were on the verge of death because people knew that opioids were dangerous. And then Purdue Pharma created this long acting opioid, so it's long release. And then they claimed that it's not addictive. And they lied. It clearly was addictive, and they got fined for that afterwards. And then they paid sales reps to essentially bribe doctors into overprescribing it. And they flooded North America with quote unquote safe pharmaceutical opioids. And then everyone got addicted. And then when it was too much, they graduated onto heroin because heroin was much cheaper, right? And then afterwards, when fentanyl came, they graduated onto fentanyl. So Purdue Pharma was essentially fined billions and billions and billions of dollars for what it did. And guess what? Purdue Pharma is the producer of Dilaudid. Dilaudid is the name brand for hydromorphone, which is primarily distributed through Safer Supply. So, and I'm going to talk to you about like an important point here. So, any kind of drug, for the most part, you have your brand version and you have your generic version. So, a company will go, they'll do some R&D, they'll produce a brand drug, they have the patent on it, which is necessary. So, they basically have a monopoly for like 10, 20 years so that they can recoup the cost from R&D. Otherwise, no one would be incentivized to research into new drugs. And then eventually out comes generics. Generics are cheaper versions. They're usually interchangeable if you use them as intended. They just kind of use slightly cheaper materials. So in Canada, we have generic hydromorphone and we have Dilaudid. And safer supply programs predominantly give out Dilaudids. And it's so prominent that the street name for safer supply hydros it's called Dillies, Dillies for Dilaudids, or D8s because we give out 8 milligram tablets. Uh, so that's the thing. Now, why do we give out just Dilaudids and not hydromorphone? That's the part that kind of puzzles me. Uh, and I think I might have an answer. So these drugs are supposed to be interchangeable if you use them as intended. But the thing is that most drug users will take these pills, which are meant for oral consumption, and they'll crush it and then they'll inject it because you get a better high that way. Now, this practice is very unsafe because these pills are not meant to be used intravenously. In a pill, you have the medication, you have the excipients. The excipients are the materials that form the bulk of the pill that basically hold the medication, right? Like the chalky stuff, essentially. Um, and the excipients in an oral tablet, like hydromorphone, is not meant to be in your bloodstream. So what happens? based on the doctors I've spoken to, is that it doesn't dissolve and it passes through your heart valve and then it gets lodged in your spinal column sometimes and then causes excruciating, debilitating, disfiguring infections there for some people. So it's not safe. You shouldn't be doing this. Uh, but for some reason, a lot of safer supply programs condone this and actively provide information on how to do this. Right. Um, Now, it seems like Dilaudid, because it is higher quality excipients, it's easier to crush and inject. And that may be why some drug users prefer it over generic hydromorphone. In which case, the government is essentially saying we prefer Dilaudid over hydromorphone because it's easier to crush and inject. That's the only rationale I can find. But if that's the case, then the government is on the hook for all the harms caused by encouraging people in some way or condoning this use of the drug. Now, if that's not the reason, then there is no explanation, and it means that all this money is going to Purdue, and we don't know why. Now, I called a wholesaler, and I realized that the price difference is not that much. So for some generics, they're like significantly cheaper than the brand. Here, Dilaudid is only about 7% more expensive than generic hydromorphone, if I recall correctly. So we're not overpaying so much. We're not totally getting ripped off, but the money is flowing to one company rather than another. And I think that warrants some questioning, some conversation.
Yeah, I would say so too. This is such I'm sorry, man. I'm beside myself because I didn't know most of this stuff. And I would venture to guess that there are people along that pathway where that money is going who are getting kickbacks in some way, shape, or form. And that's really what this. Sorry, please go ahead.
Oh, well, sorry. Now, you know what? You continue. I interrupted you there.
No, I was just gonna say that's what this stuff always boils down to, right? It always boils down to money. And the truth of the matter is, look, whether you're in San Francisco or Vancouver or anywhere else that has a safe supply program, as a taxpayer, you're paying for that program. Like you're paying for it. So it's just another mechanism to take money out of the pockets of people who pay taxes, who, let's face it, most of the addicts who are on these programs are not, and funnel it into these government corporate partnerships, as the World Economic Forum would frame it, these public-private partnerships, right? And that's really what this boils down to. And I've had this feeling for the longest time, reading your work. I'm screaming to myself, like, where's the money going? Because if you figure out where the money is going, like, for example, with Safe Supply, I've read a lot of your work. I know that there is an entire industry that's been erected around this now. So you have an industry that is literally thriving on the suffering, the continued suffering of innocent people.
Yeah. Well, I mean, I think it's more complicated. It's money in some instances, but not always. And from what
Okay.
I've seen doing a lot of my reporting in this area, many of the people who advocate for safer supply genuinely believe in it. And the problem isn't greed. The problem is ideology. So, for example, I have contacts who are friends with the Minister of Mental Health and Addiction, Yara Sachs. She is a giant proponent of safer supply. She's not qualified to be that proponent. She previously only had a yoga studio. And there's all these addiction doctors saying, wait, there's a problem here. But she's kind of captured by a small group of activist researchers. And she doesn't have the critical faculties to critically engage with the evidence base that's provided to her. So she genuinely believes that she is saving lives, which is unfortunate because eventually she's going to have to come to terms with what she's actually done whenever that happens. Most of the safer supply doctors who I speak with, many of them, they believe in what they're doing. And to a certain sense, there's a bit of naivete to it. Doctors like to feel like they're doing something good. And this is something that we saw in the OxyContin crisis, where doctors, in a sense, were willing to be credulous with patients who told them all sorts of crazy things to get opioids. And then when they realized that they were taking advantage of it, they got really pissed off. I was at a conference back in October, the scientific conference for the Canadian Society of Addiction Medicine. There was a big symposium there on safer supply. And this one woman stood up and she was talking about how her clients have gotten better and how they tell her that they're getting better and how she wishes she could share their stories. And this woman, she seemed like a great human being. She seemed so empathetic, so kind, a good person. And I hated, the thought that, eventually someone's going to have to tell her that maybe some of your patients are taking advantage of that. You've put yourself out there. You care so much about your patients, and maybe some of them are exploiting you. And that's hard to tell anyone, especially people who've sort of stuck out their neck to defend their patients. So there's that aspect. But I do know that there are some pharmacies that appear to be profiting off a safer supply. There was a report published by BC recently that was based on extensive interviews with clinicians. And one of the common concerns that were expressed by clinicians is that a small number of pharmacies were exploiting safer supply for profit. So we know that's there too. It's a complex a complex ecosystem of different motivations.
And the ideological one is a big one, right? Because when you have somebody who has like a dogmatic attachment to a certain set of ideological tenets, regardless of how intelligent they are, you're never going to be able to separate them from that, because they have almost like a religious belief in what they're doing, right? And so this lady or these people, they might be the nicest, most empathetic, most compassionate people in the world, but if they're wrong, there's no real way to tell them they're wrong, because again, they have a dogmatic attachment to what they're doing. So you can't turn them around, and unfortunately they just keep contributing to a bigger snowball. Now, speaking of that snowball, recently there was an announcement made in BC that the government was going to make fentanyl available to children. Can you talk to that a little bit?
Well, so I do want to clarify that that's part of it, but that's not the main part of what they were trying to do. But it
Okay.
is a part that does concern me. So back in August, the BC CSU, the organization that I mentioned earlier, the one that published those guidelines in 2020, they published some provincial protocols to provide fentanyl and sufentanil. Sufentanil is a version of fentanyl that's like 7 times stronger as a part of safer supply. So, safer supply fentanyl has been available in British Columbia since 2020 as a pilot project. So, there were like maybe 3 clinics that were doing it. They initially did fentanyl patches, and then they got that replaced with fentanyl tablets. Uh, and they said that they were doing well. They said they were seeing positive results. Now, were they able to actually show that evidence? No, not really. They just kind of talked to their clients, and their clients said that they were doing well. Uh, so, but based on that, the province basically said, okay, well, we're going to commission the BCCSU to write these protocols. And the protocols basically said we're going to allow fentanyl patches and fentanyl tablets all throughout the province. So now any prescriber in BC can prescribe someone safer supply of fentanyl tablets, like a regular prescription, and then you get it and it's free. And that's a problem because there's no controls there for diversion, right? You would imagine that if the government is giving away free fentanyl tablets, that they would require you to consume those tablets under supervision, and lest it make its way into the community. Because if someone takes a safer supply fentanyl tablet and then they die and it's from the government, then the government is indirectly responsible for killing Canadians with government provided fentanyl. But that wasn't there. And what I noticed there, out of the many different things that I saw, so I basically wrote the 7,000 word report that was done for a think tank known as the Macdonald-Laurier Institute. And there were a lot of problems, but one of them was the fact that this was available to youth because it counts as a medical intervention. So in Canada, if you are of a certain age as a minor, you are responsible. You can be responsible for your own medical decisions. You're a mature minor, right? And the rules differ from province to province. In some provinces, you can just be 16. In other provinces, I think it might be 15. I can't remember all of them. It's very specific. But I do know that in BC, they have a more fluid idea, which is that the child is competent to make the decision about this intervention. And competency here depends on the child's cognitive abilities and the complexity of the medical intervention. So, for example, like a 7-year-old can consent for you to put a bandage on their wound because that's pretty straightforward. But that same 7-year-old is not going to be able to consent to like a very particular kind of chemotherapy or whatever. Whereas like a 16-year-old has a lot of control over what kind of care they get or don't get. Now, because safer supply is considered a medical intervention, mature minors are able to consent to it, which means that if you have a child, the child is 15, 16, they're addicted to drugs, they can, without your consent or knowledge, they can consent to get safer supply fentanyl or safer supply, hydromorphone, which is basically heroin. And you can't stop them because that's, a medical intervention and they have a right to it. So by framing free recreational drugs as a medical intervention, the government essentially turns itself into a parent's worst nightmare in that they are a drug dealer that has unlimited access to their kid and unlimited supply, which is fucked up. And I noticed that in the protocols, there were no conversations at all about parental involvement. There was no analysis about, whether a minor can actually have the competency to consent to safer supply fentanyl when they are addicted to drugs, right? We let people who are adults, who are addicts, make their own decisions because we try to protect people's civil liberties or like their autonomy in that way. But there's no reason why we should extend that to a kid. Oh, as an aside, and this is actually a tangent, is that what was really fucked up is that in the protocols, they said that, and I quote, I'm going to paraphrase, but like literally is very explicit. It said, we have no evidence that this, can be done safely or that it has any benefits. Like they explicitly said there's no evidence to back this. And if you're a patient, to give informed consent to receive safer supply fentanyl, you have to have a conversation with your clinician where your clinician explains to you that there's a lack of evidence here, right? So they know there's no evidence and they make it a requirement of the program for you to acknowledge that there's no evidence. So they're essentially running this medical experiment on you and like taking advantage of the fact that, addicts are vulnerable and then in a way taking away their right to sue for the harms associated with this experiment, because they'll say, well, you knew it was experimental. You knew there was no evidence. So how can you sue us? It's predatory.
It's predatory. It's dystopic. Like like how would they even determine, like if I was a 16-year-old kid and I wanted to get some Dilaudid, like how would they even determine that I'm addicted? You know what I mean? Like that I'm an addict. Like there's no scientific way to determine that, right?
Well, so here's the thing: is that you can diagnose someone with a substance use disorder, and in the guidelines, they said, okay, here are the requirements for a patient to receive safer supply. One of them was that they are diagnosed with a substance use disorder, except the clinician can waive that requirement using their personal judgment, and there's no guidance provided in the guidelines to indicate when they can exercise that, which basically means that requirement is hollow because it can just be ignored at will. And I forgot the other ones because it's been a few months and I write so much about this, but I'll try to remember. But on the whole, when I pass this off to a number of addiction physicians, they're like, yeah, these don't seem like very stringent controls. The only special control for a minor was something known as a 2-prescriber model. So whereas if you're an adult, only 1 prescriber has to approve for you to get safer supply, in fentanyl, like for kids, 2 prescribers have to do it. So one person has to take your charts, go through all of that. They give it to someone else and they say, yes, we both approve. But as the doctors who I spoke to, they said, well, if 2 people are working in the same clinic, they're very unlikely to challenge each other's prescribing decisions in any significant way, aside from some issues on dosing. So let's say, Jason, you and I decide that we want to give fentanyl to kids. We're doctors. We think it's helpful. At least the kids aren't using fentanyl on the streets. So we're saving their lives, right? And we're doing this together and we both care about it. And we start our clinic and then I see this kid and I say, okay, well, I approve. And I go up to you, Jason, and I say, do you approve? Of course you're going to say you approve. You
Right.
know me. We work together. We do this thing together. So how is this an actual form of control?
Right. And in this era where narrative and ideology tend to define reality rather than, actual science, that's a very real probability, right? Because you could find people who are parallel ideologically, who work in the same building, that very well could do that. And kids are industrious, right? If they find out where they're handing out free drugs, if one finds out, next thing you know, all of them know. I mean, when I
Oh
was a
yeah.
kid, yeah, we knew where to buy weed, all of us, every single one of us, right? So what's to stop them from knowing where to get the fentanyl? Now, I know you got to go pretty soon here. I feel like we only scratched the surface, but I wanted to ask you, what's the difference between Portugal's decriminalization strategy versus what we've done here in Canada? And also, is Vancouver the only city that's doing this safe supply program, or are there other cities as well?
So just a quick answer for your second question. Safer Supply is available in most of Canada, aside from Alberta. So it's available in Toronto. It's available in London, Ontario. I don't think it's available in Quebec. They didn't really embrace that. I think because the Liberals understand that, they don't want to shit where they eat because they got a lot of
Yeah,
votes from there.
right.
So there's that. Regarding decriminalization, okay, so everyone talks about how Portugal decriminalized. Portugal decriminalized, it did so well, their HIV levels went down, their addiction levels went down, yada, yada, yada. Therefore, we need to decriminalize too. What no one seems to understand until recently is that decriminalization is not just what they did. It's not like they just said, everyone can go do drugs, whatever. That is one part of a major puzzle, and there was still accountability. So in Portugal, right now, if you have a small amount of drugs, well, first of all, you can't use it publicly, unlike in BC. Second of all, if you're caught with a small amount of possession, yeah, sure, it's not a criminal offense. You're not going to be sent to the criminal justice system. You're still going to be, held accountable, but you were just diverted to a non-criminal system, a drug court, where they have a commission that overlooks your case. It's a combination of a social worker, a psychologist, and a lawyer, and they can still punish you. They can fine you, they can block your access to welfare, they can ban you from going to certain places, but it's all not criminal, so that in the end you're not saddled with a criminal record that's going to destroy your life. And they use the threats of these punishments to push you into treatment. So the idea is that it's not going to be a criminal system. We're going to not send you to jail. We're going to use fines and other stuff. And we're going to use fines and other stuff to try to push you into treatment so you can get better, because it's a health issue. We need you to get better rather than throw you in jail, which makes sense.
Right.
And of course, the second piece for this is that treatment has to be available. Because if there's not enough beds, then you can't have a drug court, because then you have nowhere to send them to, right? So they invested so much money into treatments and like treatment capacity, like basically having it so that if you want to get treated right away, you could. And Portugal saw really, really good results for the first 5 years because they spent all that money. And this is all in the early 2000s. And then in comes the 2008 recession. There's a whole bunch of financial tumult there. It's a disaster. People have to start cutting programs. And one of the things they started doing is that they cut funding for treatment. From my understanding, this was told to me by a Swedish drug expert. Maybe he was wrong, in which case I'm wrong, but I'm choosing to trust him. And once that was cut, then you started to see overdose numbers and other issues come up slowly. And what that does is it fully illustrates how essential investment in treatment is if you're going to get people better. Now, what BC did and what Oregon did was like, okay, what if we just decriminalize and don't do all the other stuff? Right. Like, what if we just let people do drugs anywhere, because that'll quote unquote decrease stigma, and then they'll talk about their drug use, and then they'll go to treatment for some reason, and we won't force them to treatment, and we're not going to invest into treatment, but somehow they'll go even though treatment is really hard to get. And like, obviously that didn't fucking work. That didn't fucking work. you
Yeah.
know Everyone just did drugs everywhere. We saw that in Vancouver for the fucking last year, like people smoking on playgrounds.
Yeah.
And the not only are there no drug courts, at the most we'll hand someone a flyer. Here's this flyer. Look at these
Right.
treatment options, which goes
Right.
back to this idea that we often condescend to drug users. We treat them like they're idiots. Like, yes, the flyer is nice, but like, in many instances, this person is aware to some extent that treatment is there. You need to actually force them in. Like, you can't treat them like a 3-year-old child. Here's the flyer, go to treatment. No, it doesn't work.
Yeah.
Um, and we saw the impact right away. I mean, we saw Oregon has just voted to recriminalize drugs. BC is trying to do that.
Right.
Like, yeah, after 1 year, it wasn't even 1 year. Like they had this experiment at the end of January, and like
Yeah.
last year, and right away, like drug use exploded everywhere because who would have thought that would happen? Wow, how could we have guessed, right? Um, and then all the parents were pissed off because they're like, our kid is running through clouds of meth. There's syringes
Yeah.
everywhere.
Yeah.
This makes me uncomfortable. Why is someone shooting heroin by the splash pad? And they
Well,
got
they had
pissed.
to they had to create laws to keep addicts away from playgrounds, correct? Like that's how bad it got, right?
Well, so here's the thing, and this is where it gets, and this might be a good way for us to end this, because this is where the saga gets even more ridiculous. Like this is just a funnel cake of just shitty decisions, just like constantly piling up on each other. Um, So, anyways, like the government says this is fucked up. Well, everyone is mad at us. People are getting stabbed. There's drugs everywhere. We had no idea this would happen for some reason. And so, come September, they're like, we need to change this. Otherwise, we're going to lose the next election, which is coming up in a few months from now, right? So they're like thinking, in 1 year from now, there's going to be an election. We have to fix this. So the way that decriminalization works in Canada is that for BC is that we have our criminal laws at the federal level, and that's controlled by the federal government. And BC asked for an exemption. They said, okay, can you make an exemption to federal law in BC here? And the federal government said yes. So that is under federal jurisdiction, and they had the right to ask the federal government to change the scope of that exemption. And so in late September, that's what they did. They said, hey, can you recriminalize using drugs around splash pads and playgrounds and like skate parks? Because like maybe people shouldn't do drugs there. Maybe that's a bad idea. And the federal government said, sure, let's recriminalize that in that area. That's fine. And then, of course, what the BC government did about 2 weeks later, because they built upon this, right, is that they passed their own provincial law. Right. These are the different jurisdictions here, right? So the federal law comes in, recriminalizes in these very specific areas. And then the provincial government is like, well, we want more control. We don't want to have to ask permission all the time. I mean, that's the way that I interpret it. So we're going to pass our own law, which is far more wide reaching. And so it recriminalized, drug use in splash pads, skate parks, and playgrounds again. So it's a little bit redundant, but essentially what this means is that now it's banned provincially as well as federally. So the provincial government can enforce that if the federal government change its mind afterwards. And then additionally, we're going to ban drug use in public parks. We're going to ban drug use around 6 meters from the entrances of residential areas, like residential homes and businesses, near transit stations. Essentially banning drug use in like most areas that are very heavily trafficked by under people, so they don't have to deal with clouds of meth all the time, which is reasonable. And you and
Yeah,
we're still.
it's please go ahead. Please continue.
Oh, sorry. I love monologuing about it. You can forcefully interrupt me. I can talk a mile a minute about this.
Well,
But then,
it's yeah. Please keep
no,
going. Please.
sorry. I keep go ahead. Tell me.
I'm just adding, like, I'm listening to you talk and I'm like, I can't fucking believe this is our reality. You know what I mean? Like, I'm a dad with 2 kids. I moved to Alberta and I think Alberta's doing a pretty good job. They could be doing better, but they're doing a pretty good job at managing the drug issue out here. And I'm listening to you talk and I'm like, I just can't believe that this is where we are. That this is what we've done to ourselves. That's it. That's all I had. So please continue.
Well, here's the thing. So using this as fucked up, it gets worse. Somehow it gets worse. So they pass this law. They say, please do not do drugs in parks, near transit stations. Please, don't do that. And they basically let it be so that you can still use drugs, in sidewalks that are farther away from the entrance to residential buildings and businesses. So you can use it in like more commercial areas, like industrial areas, sure. You can probably use it in like alleyways. You can use it, maybe in some parking lots, whatever. It's fine. There's still areas. They're slightly more out of the way. And so what happens? You have the Harm Reduction Nurses Association, which is like, this radical activist group of like drug liberationists. And they say, no, this is unacceptable. This law infringes upon the charter rights of drug users. So we're going to sue the government to stop the implementation of this law. And guess what? So far, it's not hasn't been fully adjudicated, but it is currently sort of working. So they asked for an injunction. Now, what this means is that they're suing to stop the law, and that takes a lot of time. So normally the law would be in effect until the court rules that, it needs to stop. That takes time. So the Nurses Association, Harm Reduction Nurses Association, HRNA, they said, well, we're going to go and we're going to ask for an injunction. And this injunction will block the application of the law until March 31st. And that way, people can still use drugs. And then they got to the Supreme Court, and this is what happened. So for you to grant an injunction of a law, there's a fairly obvious, there's a fairly clear test here. So it's a three-part test. So first of all, the question is this case one of importance? And obviously it is here. Second of all, are there irreparable harms involved? An irreparable harm essentially is a harm that cannot be restituted with money, right? And then the third thing is the balance of conveniences. So essentially, in granting this injunction, do we cause greater harm to the public? Very simple test. The main thing here is question number 2. Are there irreparable harms involved? So Canadian jurisprudence states that in these kinds of situations, especially if you're trying to nullify an entire law, not just carve out an exemption for it, you have to really prove that there's going to be an irreparable harm. Like it can't be speculative. It can't be a maybe. Like you really, really have to prove that this harm is significant and it will be there. And so they made their argument to the judge. And some of these arguments were good. Some of them were bad. So the good-ish argument, which I still think is not good enough, but it's good-ish, is that they say, look, a drug user who is using drugs outside is going to be more likely to survive because if they overdose, then someone will be around, hopefully, to reverse their overdose, right? So, Jason, the stress of running this podcast is too much. You get addicted to fentanyl. You're on the street in Vancouver. You overdose. Someone walks by you. You survive another day. Great. Is it the best situation? No, but at least you're not dead.
Right.
But now with this new law, we're like, oh, I can't use outside. I'm going to use alone because my wife left me and I can't access to my kids. And then you overdose by yourself and then you die because no one's there to overdose, so to reverse your overdose. So they say, you know what, this is going to harm those kinds of drug users. They're going to die because of this.
Right.
And so the province basically responded, well, they said, you know what, there's still many other places in public where you can use drugs. We're not banning all public use. We're just banning it from areas where it's a shared space that's harming the other parts of the community. And the judge basically said, well, you know what, I accept that. But even if there's just a few drug users who die from this, that it's enough to create an irreparable harm. And my response to this is look, if you're a drug addict, we get it. You have to use drugs because you are physically addicted to it. It's hijacked your brain. It's hijacked your body. If you can't do it, you feel like you're dying. Literally, withdrawal is terrible. But we can, at the very least, expect you to be okay, can you at least not use by the splash pad? Can you at least, use a little bit farther from this? It's not a big ask for someone to use in less public areas because you don't have the autonomy You don't have like the capacity not to do drugs in this case because you're ill, but you still have the capacity to choose where you do drugs to a certain extent. So I think that that argument was a bit questionable. The other argument that they made was, for example, oh, if you take away someone's drugs, then it's going to result in them having to buy, new drugs from other drug dealers who they might not know. So they're getting lesser quality drugs that could hurt them. And like, I'm sorry, it makes a mockery of our charter rights to say that someone has a charter right to uh, to have access to higher quality drugs. Um, Anyways, the whole thing was ridiculous. There were lots of questionable arguments like that. And then the province ultimately said, well, you know what? A lot of the evidence that the HRNA has brought up, talking about the harms of recriminalizing drugs, it's all hearsay, it's speculative, it's anecdotes from non-experts. There's no real evidence here. And the judge accepted that. The judge said, okay, you know what? I accept that. I accept that this evidence is not good. But there is one report produced by the BC Coroner Service, and I'm going to rely on that because that report by itself illustrates that there are irreparable harms. So, me being a journalist, I said, well, what is this report? Let's go read it. I went there. It was a 60-page policy report. So a policy report, essentially, it's like a high-level report. It's not a medical document. A lot of it is just, introduction. Here are our policy recommendations, right? And when I looked at the actual data, it only had 19 pages of data. The rest of it was fluff. Anyone who's worked in policy knows that policy documents are usually fluff. Most of it is nonsense that no one gives a shit about. So there was 19 pages of data, which was very top level. No significant analysis here. So you have a judge making constitutionally relevant decisions on the basis of 19 pages of superficial analysis. What is this? What kind of country do we live in? So he granted the injunction. They're still waiting to, fully adjudicate the case. The injunction runs out March 31st. I don't know what's going to happen after that. I kind of lost track of the story after I wrote my piece on it. But as of now, you can still use drugs everywhere for the most part. You can't use it near schools. And because of the federal adjustment still applies. So technically you can't use it on playgrounds or splash pads or skate parks because of the federal level. But I mean, look, if police think that there's going to be, a potential human rights case involved, that people potentially have the human right to use drugs there, like obviously that's going to have an impact on enforcement. The police are going to be less inclined to enforce the law if they're worried that they're going to get, some pushback from people who said, well, you know what, you're violating their rights. Anyways, that's my spiel. This is BC. It's super fucked up. For your listeners in the United States, don't move here. Don't bring your kids here unless, unless you all want to have safe meth. Like, look, if you want to give your kids free fentanyl and you want free fentanyl and you guys just want to live on the streets and just get addicted, be my guest. Vancouver is perfect for you. Give your kids fentanyl. Why not? But if you don't want to do that, if you're an evil, stigmatizing prohibitionist who hates drug users and wants to genocide them, apparently that's what the harm reductionists say, then stay away and don't give your kids meth. It's that choice. Anyway, I rest my case.
Yeah, and it's a beautiful case. It's amazing how nowadays anybody you disagree with, all of a sudden you're genociding them. I think we've lost sight of what genocide actually means. And, just to add to what you had to say right before we go, I think the main problem stems from the fact that we treat addiction like it's a disability now, when in fact it's a choice. And I don't care who you are, what you've been through, right? I have friends who were addicts. I was there through the depths of their darkest points in their addictions. At the end of the day, it was a choice. And the funny thing is, once they do make it into treatment, which one of them, I struggled for years to try to find him a detox bed. And the only reason he was an addict for as long as he was is because the treatment was not available. And this was in Vancouver. When they go into treatment, what's the first thing that they're told? You're accountable for everything that you've done. And part of it is making amends, right? So the way that we are approaching addiction from a government level is the opposite of the way that addiction is approached on a treatment level. And that says a lot, right? We are making it so that people like you and I should be accountable for everybody else's addiction. Whereas when these addicts finally get treatment, they are told that they themselves and they only They themselves only are accountable. So anyways, Adam Zivo, man, dude, I would love to have you back. I didn't even scratch the surface of some of the stuff I wanted to talk about with you today.
Oh, yeah. No, whenever you want, in a few weeks, whenever, happy to chat. This was lovely. This was so much fun.
Oh, dude, likewise, man. I'm such a fan of your work, so it's great to just talk to you. Before we go, can you just tell everybody where they can find you?
Sure. I mean, you can find me on Twitter at Zivo Adam. So that's ZIVOADAM. I'm also, I started this new thing. It's a new nonprofit called the Center for Responsible Drug Policy, and it runs a niche Substack media wing, whatever, called Break the Needle. So you can find the info for that at www.responsibledrugpolicies.com or www.breakingneedles.com. And there you can find some of my other work. And you can also find me at the National Post. Just Google National Post Adam Zivo, and you'll find me ranting about drugs.
Yeah, you, Rex Murphy, and Jordan Peterson, the only reasons I subscribe to National Post. So you can tell them that they have you to thank for me being there. But man, I want to have you back as soon as possible because there's so many other subjects we didn't touch. But Adam, thanks so much for your time. Thanks so much for your work. And really, man, you're one of the rare few real journalists left. And it was a real honor to talk to you.
Thank you. I enjoyed this too.